Patients were asking me, what's worse for dental implants, smoking or vaping?
Between the two, there's a little bit of differences. Obviously, vaping is water vapor, but still has nicotine in the vast majority of vaping devices that I've seen. Versus smoking, that you're breathing in the carcinogens, the nicotine, the smoke itself, both carriers for nicotine ultimately, but smoke versus water vapor. So that really actually is the question. We know for a fact that that smoke coming across those wounds really does impede wound healing, but the smoke is pretty bad when it comes to its physical presence. It has everything to do with just the nicotine and how nicotine constricts your blood vessels and makes it so you get less oxygen delivery to the areas that you want it. And that's really important. So that's the case for both vaping and smoking. After you've had surgery, you need oxygen and you need nutrients to these areas. And so of course, you want those blood vessels to be dilated. You want them to be open. You want them to be delivering oxygen and nutrients to those areas so that they can heal. With oral surgery, that smoke is actually physically touching these areas as well. And so there's kind of a two-pronged effect. So the one is nicotine, and that's the case for both smoking and vaping. And the second is the smoke itself. So the smoke itself is also damaging to the tissues. So if somebody is a smoker or vapor, should they be concerned that they're not a candidate for dental implants? I would not be concerned that they're not a candidate. They are a candidate in all likelihood, unless they're combining that with a myriad of other, significant medical issues. That is certainly the exception, not the rule. We treat a fair number of patients that are smokers. Our published success rate that we publish ourselves, and we are very transparent with it and give it to our patients, it's actually 98.8%. And that's all comers. So that's people that have significant medical issues. That's people that are smokers. That's people that are vapors. That's people that are, heavy alcohol drinkers. We do know that the implant success rate is marginally worse in some of these, significant medical diseases, as well as smoking and vaping. However, it's relatively marginal.
What would smoking during your healing process do potentially?
That smoke really will impede healing. The gums are trying to reattach to each other, and the smoke is kind of getting in between, and it's preventing that from happening. It's putting toxins and foreign particles in the gum tissue, and of course you don't want that. That's going to impede your healing. And then the second thing is the nicotine. The nicotine is constricting the vessels, and that constriction of the blood vessels makes it so oxygen and nutrients don't get to those sites, and so you may not get as robust and predictable of healing of the bone and the gums as you had hoped. So which one's worse, smoking or vaping? Smoking is the winner here. It is worse than vaping. I would prefer you don't do either, but again, I'm a realist and recognize that that's not always possible, not always the case. So if we can take a quick break, a few week break around surgery, that would be amazing. If you're considering getting dental implants, these are really important topics to consider, as well as several others that I've put in a checklist below. So if you get that checklist, you'll be able to know the questions that you should be asking your dental implant provider so that you can be well informed when it comes to making a decision for your health.